Now, the federal government of Nigeria says it's left with no choice than to implement its no work, no pay policy on resident doctors for refusing to call off their strike in the middle of the country's coronavirus third wave. Egosa Igumbo reports.
For 2 weeks, resident doctors have been on strike, the third one this year alone. Negotiations over their 12-point demands appear to have failed, and neither side is willing to sheath their sword. The crisis in the medical sector is coming in the midst of a global pandemic and an outbreak of cholera in Nigeria.
We have been having long meetings with the young doctors to tell them that, look, we have a certain responsibility to our country. Every country who has difficult situation at this time should understand that the responsibility is for all of us. If you have any problem, any grudges, let's talk about it. If we can't solve it now, let's continue talking until we find solution, but don't drop work.
The federal government claims that most of their demands have been met. It's worried that a strike may hamper Nigeria's fight against COVID-19.
Your salary comes from taxpayers' money. So if it didn't work, why should you go and be saying you should be paid? Because if that is so, you can be encouraged to stay home for 6 months, and your salary is running from public funds, from taxpayers' money, and you have not given the community any service. So that no work, no pay is not just a government regulation. It's recommended, it's specifically stated in ILO regulations.
The rising number of the COVID-19 infection is disturbing, and the number of those already vaccinated is still a far cry from the 70% target of the government. Nigeria is in a race against time.
Yesterday, we recorded the highest number of single cases in a day in the third wave. We had higher numbers on the day in the second wave, but really, day to day, week to week, over the last few weeks, our cases are increasing.
The percentage of Nigerians that have been vaccinated so far is 2.3% of eligible Nigerians. We plan to vaccinate this population, about 112 million Nigerians, within a span of 2 years, starting from when we rolled out the vaccine. And this is still dependent on the availability of vaccines, right? So if, for example, we go through a long stretch without vaccines, right, that means we cannot be vaccinating, and you cannot count that as among the 2 years that we've provided.
To beat the 2022 target, Nigeria is speeding up its vaccination campaign after an initial delay.
With the arrival of the Moderna vaccine, we found out that the barcoding that is needed for the traceability was not full barcoding compared to the Covishield that we got from India. India is a little bit more advanced in barcoding, labeling, and it has nothing to do with the quality. No, it is just ability to be able to track using barcoding how the vaccines move. So what we then had to do with the Moderna vaccine is to add another label to the packaging.
An additional 40 million single dose of the Johnson & Johnson vaccines are being purchased, apart from the first 29 million doses already paid for.
It was $10 when we first started, but the price came down, and then that means we get more than we had actually originally booked. So that we boost our vaccine stock, and that tells you clearly that majority of vaccines going to be used in Nigeria is procured by government. It's not just a gift.
Despite the rising cases, the Minister of Health rules out the possibility of another lockdown. But while efforts are being made to contain the spread, the government advises Nigerians to maintain public health measures. Egosa Igumbo, Arise News.
Well, thank you very much, Egosa Osumbo, Arise News correspondent, for that report. Joining us now to discuss this is the Secretary General of the National Association of Resident Doctors, Dr. Jerry Isogun. Dr. Isogun, thank you for your patience, and thank you very much for joining us. Good to have you on This Day Live.
Yeah, thank you very much, Mr. Ruben. Good evening, Nigerians.
Thank you very much. Well, you're listening to the Minister of Health there, Dr. Sage Hanere. One of the things he also said is that, look, resident doctors should learn to be patriotic. At a time when we have the third wave of COVID-19, we have cholera outbreak in 22 states. We also have another virus that is called the Marburg virus and all other health challenges, public health challenges in Nigeria. That, look, Nigerian resident doctors should learn to be patriotic. This is the time for them to volunteer, and that this is not the time to be talking about allowances and salaries and hazard allowances and money from government. Similarly, the Minister of Labour, who is the chief negotiator for government, has said that your association should stop playing God, and he has gone ahead to file a suit before the Industrial Court in line with Section 17 of the Trade Dispute Act and Section 43 of the Labour Act. What's your response to that?
Yeah, thank you very much, Mr. Ruben. Let me use this opportunity to, first of all, empathize with Nigerians for the unfortunate situation that is happening in the health sector. I will start by saying that what the minister is displaying is rather unfortunate, and to put the record clear, that it is the minister and other workers in the health sector, in the Ministry of Health, that are rather not patriotic, because the Nigerian Association of Resident Doctors have demonstrated patriotism. I will use this opportunity to take you through the synopsis of events that have happened in the past, that before we get to where we are. You know, when this administration took over office in the midst of the coronavirus and the challenging brain drain that is bedeviling the health sector, we came together and we felt that for us that have remained here, that have decided to be here, we need to look for ways to ensure that we continue to render services to our patients. We met severally with the Ministry of Health and the Ministry of Labour with ideas how to encourage Nigerian doctors to remain here. You know, among other things, we came up with housing scheme to encourage us. We have met with government severally, and they refuse to support us. Despite that, we use our stipends, our little money, to encourage ourselves. And as we speak, we are building houses for doctors in several states in this country to encourage us to stay here. That is one of the ways we have demonstrated patriotism. In midst of this, by December last year, there was a policy that came up for central placement of house officers, so that we have, when our young doctors graduate, they will not be roaming on the street. As an association, we supported this policy to ensure that this policy becomes effective. But let me tell you what happened, Ruben. This same government, from the Ministry of Health, where the minister that is saying we are not patriotic govern, they kickstarted this policy without any plan. Do you know that for 4 months, our very young doctors were left without salaries? And this was all over the media. I want to believe that you must have seen it. That was one of the reasons why the association issued the notice of strike by 31st of March. Another issue was our doctors that were employed that helped in combating COVID throughout last year were left under the platform called Give Me. So these people were not paid salaries for 4 months. We wrote to the ministry. First, we wrote by January 31st to them. Evidence is here. They collected this document and they didn't react to it. By 31st of March, we issued them notice of strike. I need to put this clear because one of the issues being raised by the Minister of Labour was that we didn't issue enough time. We didn't follow the duration of 15 days before we went back on strike. I want to tell Nigerians that the first notice of strike issued by the Nigerian Association of Resident Doctors was on the 18th of March. That was given to them, and they didn't do anything until on the 31st of March, when the minister called us for a meeting. 31st, a day before the strike was to commence. We met and we signed an MOA. And because we have signed several documents with government without any fulfillment of promises, We met with our members, and our members said no. Salaries should be paid. The minister himself and other workers in the ministry will not continue to work without being paid salaries. As at that time, our members were owed 3 to 4 months' salaries. Members, the very young ones and those senior ones under the Give Me platform. So our members declared the strike on the 1st of April. When that strike started, the minister came on air and indicted us, saying that he had signed a memorandum of action with us. Because of that, we shouldn't have gone on strike. We listened. The Honorable Speaker of the House of Representatives intervened. And so on the 9th, we met again and we signed another MOA, an addendum to the first one. And all the agreements contained in that memorandum of action, we took them to our members. Because of the way we pleaded with our members that let us honor the Speaker, if not the people in the Ministry of Health, let us give honor to this Honorable Speaker who came to our secretariat to meet with us. We suspended that strike. When we did that, there were a lot of allegations that we were bribed as the leaders of the association. But we did that in good faith, believing that what they said they would do them. But up to today, Mr. Ruben, I'm sad to tell you that all the timelines in the memorandum of action are the lapse. All are the lapse, and they are claiming they have done the things there. If they have done that, are we mad? Are we not Nigerians? Why would we be here if they have fulfilled their promises? Let me take you through what is happening so that you get the picture clearly. One of the things contained in the memorandum of action is the payment of our house officers, like I told you. As we speak to you now, up about 114 of these people are still being owed since that time. Even if it is one person, this one person that you are not paying salary is 100% to the family. This person goes to the same market that all of us goes to. And as we speak, about 114 of them are still not being paid. And when you meet them, they will tell you that the people verified for us were paid. Who is to verify others? Is it the association that will verify them?
Well,
and these people are still working.
Can I come here? On the question of these 114 resident doctors who have not been paid, Dr. Ngige's position is that out of about 3,000 who claim they have not been paid and they've been paid, 114 not yet paid represent just about 2%. And our government is making efforts to investigate and resolve this, and that the NARD should be patient to allow the government to address the issue of these 114 doctors. Another point made by both Ngige and Ehanire is that, look, health is on the concurrent list, and that out of the 12 issues at stake, that 7 relating to the federal government have been addressed. You say no, but that there are 5 that are state-related, particularly medical training residency fund, and that the federal government should not be blamed for that. What do you say to that? Or is it that the federal government is solely responsible for issues in the health sector?
Yeah, Mr. Ruben, I would like to plead with you to remove sentiment when you are dealing with issues that concern citizens of this country. And you need to know that the agency...
I'm just quoting to you what the 2 ministers said.
Yes, I'm going to tell you this because of the way the minister... You are bringing this issue, and I expect you to have asked the minister this question. The 114 house officers, they are the doctors that just graduated. They just graduated, haven't spent 6 to 8 years in the university, sponsored by their parents. The hope of their parents depend on these people. Some of them are the breadwinners of their poor parents in the villages. And you leave them without salary for 4 months, and a minister will come on air and say they constitute just 2%. I think you should ask the minister a question. If he's not paid for 4 months, will he continue to work? Let me quickly use this opportunity to tell you that some time ago, the minister told us that they paid 37 billion to doctors during the COVID. Do you know that out of that 37 billion, the people, the minister and all the workers in the ministries collected more than 30% of that money because they were paid COVID too, COVID allowance. So when they say this, you don't know that they sit down in their offices and they collect these monies and they claim that they are paying Nigerian doctors. So let me also let you know that apart from those 114 doctors, there are more than 2,000 doctors as we speak resident doctors that are on Give Me platform. These doctors work throughout the COVID, they work even till now, and they are still being owed. Because of the intervention of the Honorable Speaker, they were paid the arrears of salaries after that first strike for 3 months. And we told this government, when we are dealing with issues of people's salaries, you cannot delay it. We told them, if you don't migrate them from this Give Me platform to the IP's platform, these salaries will reaccumulate again, and we will be back to the same point. So the minister and even the Honorable Speaker agreed with us, and it was contained in the MOA, that before the end of April 2021, all of them would have been captured. They would have finished their verification and captured them and migrate them into the IP's platform, where they made irregular payment of salaries. As we speak, the people that were supposed to do this job, they left it undone. This is one of the reasons I'm telling Nigerians that this strike was avoidable, and this strike was instigated by agencies of government. Up to today, we are yet to see those people that instigated this, that left this job undone, being punished. Instead of punishing them, we are hearing over the news, we are hearing that they are instituting no work, no pay on doctors. Where these people have come to tell you that they've been working, you have not paid them. You are not saying that you want to do no work, no pay. I think it's rather unfortunate. It doesn't make any sense. Because these people have been working, you are not paying them. Now you are coming to say that you want to do no work, no pay on them. So I think Nigerians need to know why we are where we are. And for the people that refuse to do their job that led to this strike, they should be the one that they should institute that punishment on. They should not be paid their salaries. Whereas they are in their offices collecting salaries for not working, we are here, we that were working, being patriotic up to this point, you are saying you want to do no work, no pay on us. I think all Nigerians need to come out and ask questions. Nigerian doctors are supposed to be encouraged. In the face of this COVID-19 and other health challenges that we have in this country, instead of encouraging us, you are here to punish us. Nigerians need to know that the government of today, instead of encouraging their doctors to stay in this country, they are fueling the ugly trend of brain drain. Every doctor, as we speak, has the opportunity to leave the country. But for us, we have decided to stay so that we can render services to you and other Nigerians. But look at what the government is doing to us. Well, instead of encouraging us, where other countries are encouraging their doctors, our government is punishing us. Well, so we need to know there are other issues. So let them not blackmail us by saying we are not being patriotic. Well, we are supposed to be dealing with how to improve the health sector of this country, not to be talking about basic issues as payment of salaries. We will not, nobody will work, a worker deserves his wages. Nobody will continue to work without being paid salary, including you in the studio. You will not continue to work. So help us tell the minister that these people are not demanding for any evaluating thing, they are not demanding for any extra pay, but their salaries. Well, as if this is not enough. The very young doctors, the house officers, as they are still struggling to get their salaries from government, a circular, very obnoxious circular came from the head of service, removing them from the head scheme of service that they belong to, that have been in existence all this while, that even the head of service herself, who is a doctor, the Minister of Health, who is a doctor, the Minister of Health for State, who is a doctor, all of them that are doctors benefited from this scheme. Today, in the face of this challenges that we're having in this country, they come up with a circular that they are removing these very young ones from the scheme of service.
Yes, that's my next point, Dr. Isogun.
These people are rather not patriotic.
Dr. Isogun.
No benefit that the removal of these people from the scheme of service will bring to Nigerians.
Dr. Isogun.
So Nigerians need to come and ask them, why are you instigating doctors to go on strike instead of encouraging them?
Dr. Isogun, that's precisely my next point. I'm sure you are aware that yesterday, the Minister of Labor, Dr. Chris Ngige, had a meeting with a group called Medical Elders Forum. I don't know whether, your association was invited to that meeting. But one of the things he was telling the Elders Forum is that, one, resident doctors, they are not, residency period and also NYSC period is not part of the scheme of service. he also made the point that house officers and general medical doctors are not members of the National Association of Resident Doctors, and that in any case, he thinks, he was telling the consultants, that the consultants should not join the strike. As you know, the Medical and Dental Consultants Association of Nigeria, they've also served notice of a strike. The Nigerian Medical Association has also served notice of a strike, which will result in a complete paralysis of the health sector in Nigeria. Those points made by Dr. Ngige at that meeting with the Medical Elders Forum. What's your response to that? And did you have a representative at that meeting to be able to state your own case before the elders?
Thank you very much. Yes, let me state clearly. I was in that meeting, and my president was also there. It's rather unfortunate that the meeting, the outcome of that meeting, or the things stated in that meeting was misrepresented outside the meeting. Yes, I don't want to dwell on all of that because we were there. The medical elders called that meeting to intervene in the ongoing crisis. And Dr. Ngige himself was called to give account, his own part of the account. And all that was said in that meeting revealed to the elders the insincerity of government and the agencies of government and the role some of our members played in contributing to where we are. So to answer your question specifically, the issue of house officers being our members has been long resolved in this country, and we have a court judgment to that in a ruling in the court in Shagamu. So the membership of our association is not to be determined by government. There is freedom of association, and I don't think the minister should rather be busy, to discharge what is employed to do, rather than meddling into the affairs of the association. So it's rather unfortunate, like I said, and because that is not the bane of the issue that we are facing with right now. We should be talking about how to pay the workers that have worked, that have not been paid, how to migrate them from the Give Peace platform to the IPeace platform to prevent the reoccurrence of what is happening now. Because Nigerians elected government into place. The government appointed ministers to discharge their duties to Nigerians. But presently, these people have failed. And that is why we are having this avoidable strike. So we should rather face the issues. At that meeting, it was agreed. And let me tell you, that is one of the good news that we have. Because one of the arms of government, the National Assembly, is presently still negotiating with us to resolve some of the issues, because they have come to see clearly, like you may have been aware, that there are certain things that the government promised to do since April that they have not done. And as a responsible National Assembly, they have come up to say that we need to do this thing before we tell these people to suspend the strike. And we have been available, attending all meetings, to ensure that we do this, we get results for our members. Because this particular strike is different from the strike of 1st of April. You will recall that nothing was done before we suspended that strike. It was just based on the memorandum of action and promises made by the Honorable Speaker. We suspended that strike. It shows that we are patriotic. We don't like strike. However, we cannot continue to render services when our members are hungry. A hungry person is an angry person. If somebody that you are owing for 4 months cannot continue to render good services to Nigerians. So I want Nigerians to look at us as the people that are patriotic. The government, rather, is not patriotic. That is why they have led us to this situation. So where we are today, we are hoping that the National Assembly will be able to do what they promised to do from the 2 meetings we've had with them, so that by this new week, the strike can be suspended. So we should rather focus on this issue rather than looking at who is our member and who is not our member, because that is not the issue. And no one person can determine the membership of our association. We have constitution, and the constitution of this country recognizes our association and the membership of our association. I want to leave it at that. Well,
Dr. Isogun, one other point that was raised by Dr. Ngige is that all of this is a problem because in the course of his tenure as chief labor negotiator for the government, he has had 4 different strikes to handle coming from doctors. He thinks, one, that the problem with the current president of the Nigerian Medical Association, that there was a prior agreement that anytime there is an issue at any level, the president, I think is Dr. Uja, should be the one to lead the negotiations. But that the man has been very negligent, and is the one stoking the fire in the background. And that in any case, why is it that when doctors are in charge of the Ministry of Health, his biggest problem will come from doctors, his own colleagues? And accordingly, even the NARD, the NMA, both organizations are calling for the removal of Hanire, the removal of Ngige as Minister of Labor, and the removal of, what's his name now? Tajuni Sanusi, who is the registrar of the Medical and Dental Council of Nigeria. So do you think this is a question of, medical doctors fighting their own colleagues? Because Ngige cited the example of Onyebuchichukwu and also Isaac Adewale. How would the removal of these key persons referred to by Ngige solve the problem?
Thank you very much. The issue of removal of ministers did not just come up. It is coming up because of the frustrations that the genuine citizens of this country that are rendering services to Nigerians are facing. We have come to expose to Nigerians the lackadaisical attitude of the ministries that are governing, that are supposed to be in charge of the health sector of this country. How can you explain that since April you have an agreement to facilitate salaries of those that have been working for you and you are not able to do that? How can you explain that you have some people working under you that are supposed to do certain things that they have not done, that have not led to a national strike, making Nigerians to suffer? How can you explain that? These are the questions that Nigerians need to continue to ask. So we didn't just wake up and come to be asking for removal of our members. You will also recall that some time ago, our association praised the minister for doing well because he was conciliating between us and the Ministry of Health, who has been docile in doing what they are supposed to do. And up to when this second strike started, we were seeing him, still trying to fast-track the process. And in a meeting on the 22nd of July that the Honorable Minister is quoting, that meeting came up at the instance of the association. Because we knew that a statutory meeting was coming up, by July, we knew that our members that have not been paid are coming there. It's a statutory meeting and they must come there. And when they come, somebody that is angry that, we have not paid for 4 months, what do you expect them to do? As leaders, we met with the Honorable Minister at our instance, not because he called us because of the ultimatum that we gave to him. Mark you, we have given ultimatum and shifted the ultimatum again. When we suspended the strike on the 10th of April, we wrote to the government that we suspended the strike because of the goodwill of the Honorable Speaker, and we gave 4 weeks extension of the ultimatum, allowing them to do all that they stated they are going to do in the memorandum of action. The 4 weeks elapsed. We met again, and we extended the ultimatum by another 2 weeks. Nothing happened. We decided to meet again by June 23rd. At this time, we gave another 4 weeks to the government. The government still didn't do anything until this strike happens. So you will see that we have been frustrated. As leaders of our association, we have tried our best to reach out to government. We have tried our best to ensure that the government do the needful. But as we speak, they are the cause of this strike. And we want Nigerians to know.
Well, Dr. Isogun.
It is out of frustration that we came on board to begin to ask that these people should leave if they are not ready to do their job.
Well, Dr. Isogun, we understand that 1 out of every 5 doctors in Nigeria is a resident doctor. So your association has the biggest majority of doctors serving the Nigerian people. Now, the House Committee, House of Reps on Healthcare Services, tried to intervene, but the basic point that came out of that was that the Committee on Healthcare Services of the House of Reps was appealing to your association to at least give government time because of the situation in the country. But it looked like that intervention failed. So what is the guarantee that the intervention now by the Senate will work? Now that the minister has gone to the industrial court, are we likely to have a protracted fight between government and the NARD, or you are likely to call a Congress of your members very soon to resolve this matter? And will you listen to the appeals from the Committee of Medical Elders and also from members of the National Assembly? Or you intend to fight to finish with Ngigi and Hanire?
Thank you very much. Let me correct the impression that we are fighting the government. We are not fighting the government. We are asking for our rights. Our members have sent us to ask for their salaries. They have asked us to ask for their welfare. And that is what we are out to do. Let me reassure Nigerians that as soon as we get this done, as promised by the House Committee on Health and the Senate Committee on Health, we are going to suspend this strike. Like I said earlier, we don't like strike, and that is why we have been in Abuja since the commencement of this strike, attending all meetings. If we are like they are saying, we would have called this strike and go back to our various homes and sleep. But we have been here, and we've been here attending all meetings to see how we can resolve the issues. I must tell you that the House Committee on Health have been trying, but as we speak, because they have failed earlier, they are not even bold enough to come and tell us to go and suspend the strike, because they know that our members are asking for their right.
Well, okay,
Doctor. It's unfortunate that the ministry that is directly in charge of this issue is not saying anything. Rather, they are going to court. So as a responsible citizen, as a responsible Nigerians, we are here watching. And I want to assure them that Nigerians are also watching. Let us see what comes out of court. But the truth cannot be trampled over. The truth cannot be trampled. And if they think they can bully us, we are here to tell them that we are out to fight for our rights. And all Nigerians should be aware that all we are asking from today's government is that they should pay our members their dues. As we speak, let me use this opportunity to tell you, to also dissect the issue of state that the minister is talking about. Our association comprises of members from the state. And as we speak, some state governors have put our members in a very deplorable state. Our members in Abia State are being owed 19 months' salary. Well, our members in Imo State are being owed 10 months' salaries. Our members in Ekiti being owed 6 months' salaries. Our members in Ondo being owed 2 months' salaries.
Well, Dr. Isogun,
even the salaries we are talking about in Imo and Abia, they are still using 2009 salary scale. And other state government and federal government are using 2019.
Well,
you can see how the doctors in this country have been treated.
Dr. Isogun,
we didn't present these issues to federal government to attend to. Rather, we are using this same window to address the issues of our members in the state. And we are calling on these state governors to address the issues of our members in the state.
Well,
in the same country where we have state governor in Delta State that has done all that we are talking about today, has paid the MRTF that we are talking about, has paid the arrears that we are even still asking federal government to pay. The Delta State government has paid. The Benue State governor has also paid the MRTF. So other states need to follow through and do the same thing, because it's the same patient we treat in this country. Coronavirus does not select the state to go to. It's everywhere in the country. So we are calling on Nigerians to prevail on this governor. In a similar claim, the president should be calling those governors to do the needful. Rather, they are pushing it away, saying that those issues are state governor issues. Are these doctors in those states, are they not citizens of this country?
Dr. Isogun, yes, you have talked about welfare. You've talked about salaries. You've talked about residency training, postgraduate allowance arrears that have not been paid. But some Nigerians are saying, well, is this all about salaries and allowances? How about healthcare financing, the state of healthcare infrastructure in Nigeria. I mean, we're faced with a situation that if the governor of a state has headache, he will be looking for an opportunity to go to Dubai or the United Kingdom or the US. Why is the Residents Association not concerned about the bigger issue, about health infrastructure, the state of healthcare, so that we don't have our leaders always rushing to London or rushing to Dubai for healthcare?
Thank you very much. You agree with me that if you are hungry, you cannot even go do what you are supposed to do. If Nigerian government is still struggling with payment of salaries, that tells a lot. When we kick off in this administration, our plan is not to be fighting for salaries. I told you the program that we rolled out, that we met with the government and we met with the Nigerian Governors Forum about how to promote telehealth in this country, how to ensure that 1 million Nigerians get health care, even in the villages, how to ensure that we propagate the message about coronavirus to our various patients in the villages. As we speak, we partner with a company already where we spend a lot of money from our session to make sure that we pass the messages to our patients, to ensure that our patients are in the comfort of their homes, because we envisage that with the advent of coronavirus, patients do not need to be coming to the hospital. They need to be at their home and they hear about how to take care of themselves. We did this just as we were about to launch this program, this strike came up. That was why I told you that it's rather unfortunate that this strike was instigated by the agencies of government, and we expect government to punish those that led to this strike. That is what we are waiting for. Rather than doing that, they are punishing those that are crying out, asking them to do the needful.
Well, Dr. Isogun, if it's any consolation, Ben Akabweze, who is the Director General of the Federal Budget Office, says about 5.5 billion naira has already been captured in the 2021 supplementary budget, and that, this will be used to pay allowances for doctors. Do you think that perhaps you should have waited for that supplementary component of the supplementary budget to be deployed before you went on strike? Will you say you probably went on strike too soon, knowing that there is a 5.5 billion naira that is waiting to be disbursed to pay allowances?
Mr. Ruben, like I told you, you have the communique that we wrote about this strike. This strike is not just about medical residency training. And if I must tell you, this Medical Residency Training Act, an act of federal government of Nigeria that was passed since 2017, it took a strike last year for doctors that these monies are meant for to receive the money for the first time. And since we came on board, we met with them. We said, we don't like what happened last year. We want them to do what they are supposed to do so that members, residents that need this money to go for exams and update what the monies were meant for should get these monies. We met with them severally until now. It's taking another strike for us to be hearing that such money is in the budget. Even when the speaker met with us, it was the speaker's intervention that made them to put it in the supplementary budget. Are they not supposed to have put it in the main budget? So you see people that are telling us that they will implement no work, no pay on us. They were supposed to have done their job. They didn't do it. And now we are on strike, making Nigerians to be suffering. It is now they are talking about that they are putting in supplementary budget. It is rather shameful. But to put the record straight, we are not on strike just because of Medical Residency Training Fund. I have told you the basic issues as payment of salaries of our members. So you cannot share that. You cannot sweep that under the carpet. As we speak, these same members are not yet paid. And some people are saying they should go back to work. If they go back to work, what would they use to transport themselves to work? What would they use to feed? These people cannot feed themselves, cannot feed their families. If you want to leave your house and go to work, your wife says you cannot go anywhere because you are not provided for this family. It is rather shameful.
Well, on that note,
the situation is as bad as that.
On that note, Dr. Jerry Isogun, General Secretary General of the National Association of Resident Doctors of Nigeria. I'd like to thank you very much for joining us. Thank you very much.